Well, Michael, we're finally doing it. We've had this idea of talking to different practitioners where their level of expertise inevitably overlaps with what we do in the family law context. And we had the privilege of talking to a couple different practitioners. So who are we talking to first?
Yeah, and our first guest is Christine Golden. She's a licensed marriage family therapist. So here we go.
Miss Christine Golden, how are you?
I'm good. How are you?
Good, thank you. So we're really happy to have you here this morning. And why don't you start by introducing yourself and tell us a little bit about what you do?
Well, thank you so much for having me. I'm super excited to be here. And so, as you said, I'm Christine Golden. I have a master's in psychology with a specialization in counseling. So I am also a marriage and family therapist, a licensed practitioner. So the majority of the work that I do is actually a little bit of a specialization with families that are in what we call high conflict. So a lot of times parents going through difficult divorces and they bring their kids into me because their kids are going through difficult things.
What are some common characteristics or traits that you see in children that are the unfortunate sort of bystanders or the collateral damage, if you will, when the two parents are in a high conflict relationship?
It's really interesting because a lot of times when the kids are brought into me, their parents have been having a lot of discord and difficulties for a while. So the kids are usually the kids that I see are really highly impacted by this. And it looks like, it's an array of different, what we call like symptoms, behaviors, kind of the way that they are responding to what's going on. So a lot of times, there's emotional difficulties. Sometimes that's more what we call like internal, where you see depression, anxiety, more of the difficulty with moods and being stuck in kind of a difficult place. And then sometimes we see when kids, what we call like act out. So that's like externalizing their problems, getting into trouble at school, having, difficulty with their grades, their academic performance really drops, or they just start getting into trouble or having relational difficulties.
With respect to, because this is an issue that I see on the sort of family law side of things, when, for instance, parents tend to use the child or children as messengers, can you sort of speak to how that may affect the children? Because the parent might think, well, what's the big deal? I'm effectively telling my child, right, our child, to relay some information to the other parent, but not necessarily sort of maybe comprehending how that may affect the child in relaying information, even to the extent that my parents can't even talk, right? So how does that, from your perspective, what do you see with children that are oftentimes used as maybe messengers?
So it is really common that kids get put in that position where their parents are really having difficulties communicating. And it really, when I'm talking with children and helping the parents understand the position that they're putting the kids in when that's happening, is they are putting their kids in the middle of their issues. And, they can think that, well, my kid's just telling her mom about pickup, or their dad about, something that seems trivial. But in doing that, it really is creating a lot of confusion for the kid because they understand the discord between their parents. And now they're trying to cater to both of their parents, trying to please one parent by conveying the message, and then the other parent by, communicating the information in a way that can be pleasing to that parent, or, they understand the discord and it becomes their responsibility to take care of their parents' feelings in doing that. And it really it's very complicated and confusing for the child.
What about, and this is a common situation that we see, is allegations that one parent may be influencing or manipulating the child or children, right? And to some extent, I've seen from personal experience in cases where yes, I mean, it's clear that this child seems to be somehow impacted, whether it's the information that they're relaying or how they may be relaying it in relation to sort of their age and just words that they may use, right? Or whatever it may be. So, how do you deal with, or maybe you could speak to any cases more from a general perspective on instances where there's influence and manipulation by one parent, maybe talking negatively about the other, and how that child or children may perceive the other parent, if that makes sense?
Yes. And that last word you used when you threw in perceive, that is a huge part of how I try to describe what it is that's happening. And it is common that, parents have their different experiences of the situation. And when there's high conflict, there's clearly very different perceptions and understanding of the situation. So when one parent is describing what their understanding of that parent, that clearly they're in a difficult relationship with, the message that the child is getting is a very negative, or a little bit, if you're thinking about it from more of an objective view, it would look a little bit different, but they're getting a subjective view. So it is a little bit skewed. It's through one parent's understanding and experience of how they're experiencing the other parent. So their opinion, what they're feeling is going to be in there. Or sometimes, parents say more just fact-based, like, this is what your mom is doing, or this is what your dad is doing. And it creates a really, again, ambiguous situation for kids because, just especially depending on their age as far as child development goes, it depends so much on the stage that they're in and understanding being what we call like an individual. The process is called individualization. And if the kid is younger, they often perceive themselves as part of their parents, extensions of their parents. So to understand one parent in a negative light is very confusing for a child, and it does begin to impact their perception of the child. And I want to get back more to the manipulation piece that you were speaking about. So it is a skewed understanding that they start to get and will expand on because they don't have information that is counter to that. So it is really confusing, and it can cloud their perception of what's happening. So it does start to create, a very difficult understanding of their parents. Their parents are either like all good or all bad. One parent is good, one parent is bad. It feeds into this high conflict situation. And it is manipulative in that, it's trying to get your kid to side with you and to have the same perception and understanding of their parent, which is not appropriate for a child. And again, it is more of a subjective view. So, to help that, it's important to kind of try to understand, from this child's perspective, we want them to have a better understanding, for developmental purposes and just for their own health, their own opinions. There's something in the middle where they may see something that mom's doing and something that dad's doing, but they have like a counter to it, like also, what they think about it, to kind of help that individuation process so they're not so fully immersed in or impacted by those perceptions, the negative perceptions that their parents are having of each other.
And is it safe to assume then that that's probably where a majority of the sort of the therapy may be focused on, so that the child may not necessarily look at and perceive the parent the way their other parent may sort of be perceiving them, right?
Sometimes, yeah. Sometimes there is a lot of, I hear the term alienation often, and one child will kind of start to side with a parent, and it wouldn't be, my job or part of counseling to tell a kid how to think about something, but more so offer them different perspectives. And it's amazing if you ask a kid, oh, this is what dad told you. This is what mom told you. What do you think? And let them try to understand, well, yeah, this is true sometimes. Often I hear like a parent is mean or someone lies. And then they can kind of go like, well, yeah, there's this one lie, but then no, mom tells me the truth a lot of times, or no, dad's really nice to me sometimes. And so they can have more of a balanced perspective and understanding of the situation.
Makes sense. What about situations, because I see this commonly as well, certainly a point of contention is where one parent may attempt to introduce a new partner, right? Whether it's a new girlfriend or boyfriend or fiance. And not just that, and maybe that partner has kids of their own, and how the other parent may feel with regards to, I don't know if our child's ready yet to be introduced to your significant other, let alone their kids, right? So from your perspective, where do you see it from, children sort of maybe dealing with or coping and trying to sort of understand that, yeah, maybe dad has a new girlfriend or mom has a new boyfriend. Do you speak to that?
Absolutely. And this is a really tough situation. It does often, depend a lot on the kid's age, again, and their personality. Sometimes when kids are younger, they're more excited and accepting of different family members. They, don't have, and I don't want to say the full capacity to understand, because it's appropriate for where they are developmentally, but to, be excited to have a stepmom, or the idea of, dad has a girlfriend and someone to play with. And then, for teenagers, it may be a little bit different, where they feel, this isn't my mom, this isn't my dad, I don't want anyone to be replaced. I don't like, the siblings or the potential step siblings. And it is really difficult. I think it has a lot to do with, the personalities of the kids being involved too. And sometimes there is, the parents, again, perception that's going to influence that. Like you were saying, a lot of parents get really upset and they tell, the kids, they shouldn't be doing that. You shouldn't be meeting them. Or if there has been an affair and that person is introduced, that's, really, really difficult for everybody in the family. And again, puts the kid in this confusing situation of, do I accept this person into my life? Am I nice to them? And it's natural for kids to bond with people, and especially with older people that are in more of caregiving roles. And not to say that, a step parent or someone dating a parent is going to be that, but in that context where a kid is looking up to someone and, they're going to be helpful to the child, it's very natural for a child to bond with that person. And it's less often that it happens that a kid is going to perceive someone negatively. And then, that's where the different perceptions and the impact of the parents saying, this is who your dad had an affair with. This is who your mom is deciding to introduce you to, and I haven't even met yet. And it puts the kid, again, right in the middle of the situation and trying to understand how to navigate that relationship with them and, what they're going to communicate when their parent asks, how was your weekend? What they're going to say, if they're going to include positive, and mostly that doesn't happen. They want to include the negative to support the other parent and their experience and difficulties. So these are really, impactful situations for kids to go through.
Yeah, we certainly see it a lot on our end. Speaking of seeing things a lot or hearing things a lot, and you and I were talking about this earlier, and I don't know what it is and why, but I get a lot of calls from prospective clients, and when trying to understand their situation, it inevitably comes up, and that's the other parent is a narcissist. Now, narcissism has existed for a very long time, but for some reason or the next, it feels like it is prevalent, right? And everyone is diagnosing the other spouse as being a narcissist. And again, I'm not, marginalizing or saying that anyone may be wrong in perhaps Googling what common traits or characteristics of one are, but nevertheless, it's something that I've hear a lot. I talk about it with my partner, and it just seems, yeah, it's common. So do you hear that often? And how do you effectively, maybe when working with a parent or trying to help a parent and giving them the tools and dealing in a high conflict situation where they are adamant the other parent is a narcissist? What do you do in those situations?
It is such a buzzword right now. If I had a penny for every time I heard narcissist, it's a little bit of a phenomenon. And I think right now mental health is, kind of trending, or people are more open to and more educated about it now, and understanding of what narcissism is really, there's information, like you said, you can Google it. It's at our fingertips now. And I think there is a little bit of an over diagnosis that, you kind of mentioned earlier when we were talking, where everyone's diagnosing each other now. But there are a lot of characteristics, and the characteristics of narcissism are more prevalent in the people that we work with, because they're high conflict situations, and that's not very typical. You usually see a lot of people that are able to work things out and mitigate conflict or limit it. And when there is a more difficult personality, and we don't have to say even that it's a full-fledged personality disorder, but even that, there's some characteristics here going on that are creating a lot of conflict. I do think that it is really common that a lot of those things are valid with the families and parents that are going through the situations that, they come to us under the context that they're in. And I'm sorry, I feel like you asked me something at the end of that and I got excited about narcissism and I don't feel like I circled back.
No, I think you did, because I was excited about talking about it. And again, I certainly don't want it to be perceived or construed as if I'm, making fun of it. I'm not, right? But nevertheless, narcissism has existed for a very long time, at least my understanding of it. And maybe it's just the access and being able to easily Google something to, try to understand what something is. But, maybe if one parent is particularly adamant about a particular issue, does that in and of itself constitute, a diagnosis of narcissism, right? So I think it was very well explained, and it makes sense, right? The nature of the situation, and, which is maybe not normal. One parent may exhibit certain sort of traits or characteristics of it, but not necessarily be a quote unquote narcissist, right?
Right, exactly. And I think that's so important with the characteristics too. And I do think, because we have this information now, we can more quickly link things back to like, oh, that's a narcissist or that's narcissistic. And it doesn't warrant, the diagnosis and everyone that we see. But it is, I think the understanding of what that is growing. And that is why we're seeing it more often, because we're actually able to identify it. And, before it was said that the percentage of narcissism was incredibly low. And it's really interesting too, because like I said, too, the people that we spend more time with are in these high conflict situations. So it's the sample size that we get where it seems like, oh, maybe there's a lot of it out there. I think there's more characteristics of it out there. And it's a little bit more prevalent than previously diagnosed, because it's hard to diagnose narcissism because people don't endorse those criteria in themselves. So it is underreported, but it is not, you don't see it as often as that term is thrown around.
Trust me, very well taken. And again, this was a conversational piece that I was looking forward to talking with you about, because again, I hear it all the time.
So Christine, you talked with Jason about the work you do with kids. I want to talk with you about the work that you do with parents. Can you talk a little bit about that?
Yeah, of course. So often, kids are brought in to me when they're going through a difficult time. And a lot of the times, what I find is really helpful is actually doing a lot of work with the parents too. So when you think about it, when kids come into treatment, I get to spend an hour a week with them. So I find it's a lot more helpful is working with parents and giving them some tools to help support them, both with the kids and helping, respond to their kids' needs and the different difficulties that their kids are having. And then also to help the parents with their own stress of these situations. These are really, really impactful situations, as I was saying before, for the kids, but it's so impactful for the kids because of everything that the parents are going through. So these situations are very high stress. And, in our terminology, high stress, goes right in line with traumatic events. So the ending of a marriage, all of the issues that come up can have really significant anxiety, stress, and traumatic presentations. So a lot of the work that I do is with the parents and helping support them as a parent and support them in understanding new tools. And like I said, to help with the kids, but also to help with their relationship with the other parent. And a lot of times that is creating stronger boundaries for a parent, helping them with their emotional regulation. A lot of times they see their kids upset and it feels like an emergency, and it's really a difficult place for parents to be in. And even, with dealing with the other parent, there's a lot of sensitivity often to the different responses, that I was kind of talking about the perception that these parents have of each other. So, if someone feels very wronged by, or just the pattern of high conflict that these parents are in, all of their perceptions and the different situations that they're in with each other are really jarring. And you can see, things that seem very trivial or a very small situation can really erupt really quickly. So like I was saying, a lot of work that I do with the parents is to kind of help them understand and minimize their big responses, their emotional responses to both the kids and the other parent, to get them more to like a neutral place.
Yeah, and something we see a lot, at least in our cases, is we have parents with different parenting styles that may not mesh well together. You have kids that go from one household that have one parent that maybe has a certain routine for the child, and then they go to the other parent's house and it's different. How do you help the parent kind of navigate through that, or maybe have them make sure they're on the same page so that the transition is easier for the kids?
I'm so glad you asked that, because this is a very common occurrence with families that come in to see me. The parents are very different. Their understandings of life and also parenting are very, very different. So a lot of times one kid, or when a kid is at one parent's house, they'll have a certain way of living. It can look like a lot of routines, like bedtime, homework time, dinner time, where it can be very like regimented. And then sometimes other parenting styles are much more lax and go with the flow, and we see how we feel. Or a lot of time is spent alone without, interactions or family activities. And there can be a whole array of different arrangements and environments that these parenting styles, have for the kids in their different homes. And it is really difficult for kids to transition from one to the other, to the other, I would have a hard time doing that, like switching homes every week or every 2 days. And so I think there is a lot of work in helping the parents understand maybe a little bit of a middle ground. And I know it's hard because parents, have their schedules and their lifestyles and the way that they want to live. and, really just understanding it more from the child's perspective, creating some consistency, having a little bit of an understanding of like, okay, do we maybe have a little bit of a bedtime, or do we limit screen time, or what are some commonalities that we can have just to decrease like the confusion and the vast different environments that this kiddo is going back and forth to.
And I have to assume that there's a lot of parents out there that are maybe fixed in their ways and may provide some resistance in wanting to change their routines. Do you encounter that a lot? And if so, what do you usually do with that?
It is very common. And I think one of the things is really exploring why that is so important to the parent. A lot of times, people feel that they weren't able to live that the way that they wanted to in their past relationship. And so there's really like, well, this is how I want to do it, and this is how I want to live. And when you can kind of like help a parent understand where that's coming from, if they do have any kind of things that they can let go of, or just see from a different perspective, if they knew something that they were doing was negatively impacting their kid, then like, oh, now we can kind of go, okay, well, what's like a little bit of a middle ground, or help them understand. And, people often say like, I don't want to change. And I don't think it's really about changing. I think it's about, creating and adapting to a kid that's going to, probably, if they're in this situation, they're not responding well to what's going on. So what are some like fixes that we can make for them, rather than thinking it's like, oh, I need to do all of this because of my ex? It's like, no. What does the kid need? What is the kid asking for in these situations? And, I don't mean, giving them everything that they're asking for, but just understanding what a healthy environment and having some of that consistency looks like for the kid.
And I'm sure with kids, I think a lot of parents don't understand or realize the impact that their actions have on their kids. And oftentimes I have to assume they probably think they bring you the kid and they say, hey, address this with the child. And they may not realize there's things that they have to address themselves that has an impact on the kid, right? And do you find that parents are usually pretty receptive to that idea? Because I have to assume a lot of parents don't realize that it's their conduct that's causing the kid to maybe act up or perform poorly in school or just misbehave.
You're nailing that. Yeah. A lot of times parents really don't see the impact that they are having on the kid. And so there is a lot of, difficulties that are ran into when a parent is struggling with that. And I think the parent's focus is so much more like that it's the kid's issue. And like you said, I hear this all the time, like, fix him. Like, what can you do with this? And I think, there's some work to do with, the kid and helping them have, critical thinking skills and problem solving skills and understanding different resources that are available to them to help them with the issues that they're having. But there's really a lot of work that the parents can do also. And, I think this kind of like bleeds into what we were talking about too. It's not so much about them having to change everything about themselves, but to kind of be able to cater to what it is that the kid is needing.
But do you find that your approach is very different when you're dealing with different ages of children? I have to assume that's the case. But how do you, what are the differences that you notice when you're working with kids, perhaps teenagers, as opposed to when you're working with younger kids, like 6 or 7-year-olds?
That's a great question. So the work that I do with younger kids is more of helping them process their feelings. A lot of times, if a kid is that young coming into treatment, there's a lot of emotional difficulties. And I think I spoke to that earlier as far as the emotional difficulties and the acting out. And when you see a kiddo that young coming into treatment, they're often having more of a traumatic response. So how that is supported in treatment is a lot of times it's much more through play therapy and helping them process events that have happened to them. in a way that they can have it feel less traumatic and move on in a healthy way. Whereas with older kids, it is more of talk therapy and helping them with the different tools that I described earlier and getting them support. But the interventions can look very different with kids and teens, and it so much depends on their personalities too. Sometimes, they are more reliant on people and their relationships. Sometimes they need to find more things that make them happy. We call these like coping skills, things that they're good at or that they're interested in, that they enjoy doing, that really helps mitigate a lot of the difficult emotional symptoms that they're experiencing. There's an array of different approaches with different ages, and I try to tailor treatment to what is going to be helpful for that client and what it is that they're experiencing, if they're acting out, if they're having the emotional difficulties more internal, and kind of trying to link and get them more support in the areas that they need. Sometimes it's academic, sometimes it's like in their relationships, sometimes it's with, like I said, like depressive symptoms. So it really depends on what they're going through.
Yeah, something that at least I see in a lot of our cases, especially with older kids, is that they tend to be more aligned with one parent, right? Perhaps it's the parent that they spend more time with, right? Or perhaps because the parent is, you've heard this term before, the helicopter parent, right? This parent that wants everything done his or her way, and the expectation, at least to that parent, is that the other parent do have the same routines and processes with the children as they do. And there's different parenting styles. So can you talk a little bit about that, about the different parenting styles, and with those helicopter parents, if you will, how you kind of break them down, or not break them down because that sounds negative, but how do you navigate through that, and what kind of resources do you give them to understand and accept that there's different parenting styles, and what you may do may not be what the other parent does. That doesn't make it bad. It's just different parenting styles.
Right. Yeah. So there are, an array of those different styles. And what I think is helpful too, like you spoke earlier about how one kid can align with another parent. And it's really interesting because kids have such different responses to their parents. And sometimes it is the parent that they aren't spending so much time with that they are yearning for, and start to see that parent in a better light and start criticizing the parent that they are with and everything that they do. And there's 4 different types of parenting styles, and all of the styles will fit into those types. But we often see, different styles in each household with divorce, and not always, but it's more common to see that. And again, I think it is finding a little bit of a middle ground and understanding what those parenting styles, how they impact the kids, what kind of environment is being created for the kid, and how is it affecting them? These parenting styles make it very clear and easy to understand how your kid is going to be emotionally impacted and what kind of difficulties they are likely to have if you continue this parenting style later down the line. And then it becomes a little bit different, and we spoke to this earlier too. It becomes about that parent and understanding developmentally what's best for the kid, not so much about their parenting style and their lifestyle. And, it's not about the other parent. I want it this way, they want it that way. It's just about, what's a healthy environment for the kid.
Well, Christine, thank you for coming on today. They're taking time out of your busy schedule. What you do is very important, and it was very helpful to talk to you and have our audience listen to what you have to say. And we appreciate you coming, and we hope to have you again soon.
Thank you so much for having me. This is really fun, and I hope to come back too.